I'm proud to be joined by Drs. Michael Parry from Stamford Health and Nabeela from Nuvance Health Systems. Our subject matter for today is coronavirus vaccines and variants. Thanks to you both for being here. What a year it's been. February signifies an entire year that we here in Connecticut have been fighting the novel coronavirus and seeking the best treatment available for COVID, the disease related to the virus. We're also tracking several variants of the coronavirus. Viruses constantly change through mutation, and even new variants of the virus are expected to occur over time. The United Kingdom identified a variant called B.1.17 with a large number of mutations in the fall of 2020. In South Africa, another variant, B.1.351, detected in early October 2020. And in Brazil, a variant called P1 emerged and was called during routine screening at an airport in Japan in early January of this year. This variant contains a set of additional mutations that, according to the CDC, may affect its ability to be recognized by our antibodies. This variant was first detected in the US at the end of this January. Dr. Parry, what are the benefits of being vaccinated early?
I think from my own perspective, now in the middle of the vaccination campaign, and we're doing 1,000 vaccines a day at Stamford Health, that these vaccines, I just would like to stress so we can address the hesitancy of some folks about getting vaccine. These vaccines are very safe. They cause a lot of nuisance side effects, right? With a little pain at the injection site and fatigue and maybe a little headache. But those symptoms last a day or two and then they go away, and the patients really do fine with these vaccines. And they are so effective, 95% effective, that the hesitancy is something we just need to address on a daily basis. It's very clear these vaccines prevent death from COVID-19. They prevent hospitalization. If you get sick with COVID-19, it's usually mild. You don't end up on a ventilator. You're not in the ICU. They are incredibly effective. From some of the UK and Israeli data, it looks like they do prevent transmission in asymptomatic people. And for most of us who want to, be active and social in the community and travel and do things that we used to do a year ago, it really makes very little sense objectively not to get vaccinated if that vaccine is available. So I'd like people to take away the fact that this is a safe, very effective vaccine. There will be more vaccines coming that don't require 2 doses, and the complexity of, remembering you have to show up for that second dose. But we need to get back to a more normal life. There's a lot of depression out there. Suicide rates are up. Businesses are closing. People's lives are being torn apart by the pandemic, and understandably so. But we have to be able to create some balance. And the vaccine, in my mind, is the way to do that.
Dr. Khan, here in Fairfield County, which variants have been discovered thus far, and how prevalent would you say they are relative to the original virus?
So as of yesterday, actually, the total number of confirmed cases here in Connecticut have been 276,691, out of which 79,237 cases have been in Fairfield County. Currently, 511 patients are hospitalized, and there have been 7,572 deaths related to COVID-19 in the state of Connecticut, 2,000 of which roughly have been in Fairfield County. Our current daily positivity rate is 3.92%. And so far, according to the Connecticut Department of Public Health, we've had 42 cases of the UK variant, also known as the B.1.1.7 strain, that has been detected in Connecticut. And only one of the South African strain was reported in a Fairfield County resident. So far, that's the B1351 strain, and that individual is hospitalized in New York State.
Thank you, Dr. Parry. We've been tracking the development of these vaccines together for quite some time. Some require 2 doses, some require just 1. Is there a concern that these vaccines will lose their anticipated effectiveness dependent upon these variants that Dr. Khan mentioned?
That's obviously a theoretical concern. With each mutation, and these variants really represent many mutations that have happened since the original Wuhan strain in December, January of last year. So the mutations, many of which are inconsequential and don't result in any change in the virus, but some of them are related to their infectivity. They may be more contagious. Some of them might confer more lethality. They may be more aggressive. And some of them might change the structure of the virus enough that the immune recognition has changed. There's a suggestion that, particularly in the sense of changing the immune recognition, that has already happened. The monoclonal antibodies that we use to treat patients who are in the community, who are moderately sick but not sick enough to be hospitalized, but those monoclonal antibodies don't work so well in some of these variants. As of today, based primarily on large studies in the UK and in Israel, the B1351 and the 117 strains don't seem to confer resistance to the antibodies produced by vaccine. So we think that the 2 vaccines that are currently out there, the 2 mRNA vaccines from Pfizer and Moderna, confer immunity that covers these 2 strains. Again, some of that data is inferential and not sort of ironclad, but that's the suggestion at this point in time, which I think is good news. We've seen in Israel, for example, that where over 40% of the strains are the UK B117 strain, that the vaccines have worked very well and seem to be up to that 95% effectiveness in large populations now that have received them. So that's very encouraging. There is another mutation, the Brazilian strain, is called a P1, which we haven't seen in Connecticut, but has been seen in a few states in this country. That is a little bit more worrisome. We're not sure about how the vaccine will protect us from that strain. So it's an open book. We have to wait and see what happens. But so far, so good. I think we can trust the vaccines we have at this point in time.
Thank you. Dr. Khan, it's been reported that some physicians have either informed their patients to take one vaccine over the other. Other physicians have told their patients to wait a prolonged period before being vaccinated. Can you help our listening audience understand why a physician may choose one vaccine or the other, or maybe requesting their patients to delay being vaccinated?
So I think Dr. Parry alluded to this. Currently, there are 2 vaccines that are available. One is by Pfizer, the other one's by Moderna. And actually this morning, the FDA announced good information about the Johnson & Johnson vaccine, and we'll get more information in regards to the emergency use authorization. So far, 13.5 million doses of both vaccines have been administered throughout the United States, and the CDC is monitoring the adverse events, and only 7,000 adverse events have been reported, 90% of which have been non-serious. The CDC does recommend that most individuals can receive the vaccine with certain caveats. So people who've had an allergic reaction, a severe allergic reaction after the first dose of COVID-19 vaccine, or those who are allergic to the components such as the polyethylene glycol and polysorbate, that's where caution needs to be taken, and it's still recommended that they can seek an allergist and immunologist to determine if it's fairly safe or not. And people who've had a COVID-19 infection and have actually received monoclonal antibody, the one that was approved by the Eli Lilly, bamlanivimab, and the Regeneron cocktail, it's advised that they should wait at least 90 days prior to getting the vaccine, and so that the vaccine can be efficacious and the immune response can be robust from the administration.
Thank you. Dr. Parry, we're now entering a phase where teachers are being vaccinated, and we've spoken many times over the next 3 to 4 weeks, I guess, getting us into to April, rolling out those vaccines to our schools, to the staff, and to our teachers. Why is it also important, as the vaccines are being rolled out, that we continue also testing in great number in the reverse transcription polymerase chain reaction?
Well, I think that because only a small percentage of the population has been immunized, vaccinated as of today, I think we're probably around 10% of the population in Connecticut. We're probably, I think, around 60% or so of the 75-year-old population, maybe a little bit more by now. We certainly don't have the concept of herd immunity. Right, so there are lots of non-immune people out there. We know that there's lots of asymptomatic infections in the community. So we continue to need to wear masks and socially distance until such time as we've shown that, one, the vaccine prevents asymptomatic infection, two, that it prevents transmission. Despite, we know it prevents disease, but does it prevent transmission in asymptomatic individuals? And we know that we need a herd immunity throughout the population of probably well over 50%, probably 60 to 70% before the propagation of the pandemic slows down and stops. So it's important that we continue to do all the things that we have done to date. The other thing to realize is that these measures, wearing a mask, washing your hands, socially distancing, limiting travel, have done unbelievable things to our flu cases this year. In Stamford, we normally, by this time of year, end of January, we've seen 600 cases of flu, 400 cases of RSV, and this year, since September the 1st, we have seen a total of 2 cases of influenza and 1 case of RSV, total over a 4-month period, almost a 5-month period. So it's astoundingly effective. If we were to be wearing masks every year during the flu season, we might not have flu seasons. It's tougher for COVID because it's a more contagious disease. There's more asymptomatic infections. And so I think that's why it's not working so well for COVID, but it works amazingly well for the protection of us from influenza and RSV.
The positive aspects of wearing masks and being tested certainly have proven out, but there has been reported secondary complications from patients deciding to prolong or to put off certain procedures, for them putting off seeing their primary care physician, their subspecialist. Dr. Khan, what are you seeing, and what communication would you be providing to our listeners on the importance of them continuing their practice of medicine?
So the pandemic has taken a tremendous impact, not only on mental health of the patient population, as well as routine medical care. We are seeing that patients are anxious about completing routine lab requests, or even keeping up with routine cancer screening, such as getting mammograms or even going in for colonoscopies. It's extremely important that patients do keep up with routine care, as delay in seeking screening measures can result in delay in detecting and diagnosing of sometimes aggressive cancers. Now, the lab facilities as well as ambulatory settings have policies and procedures in place to sort of mitigate the risk of COVID-19 as much as possible so patients can keep up with their routine screening as well as laboratory procedures. The public health mitigation strategies have also had a tremendous impact on patients' mental health per se. There is, in my primary care practice, I am seeing a lot of depression and anxiety, not only anxiety related to contracting the disease, but patients have had interruptions in their daily routines. Patients can't go to the gym, for example, or perhaps see family members out of state, their grandkids. Holidays and special occasions have appeared very different this year as compared to last. So patients have been seeking and inquiring a lot about therapy sessions. We've sort of to address these concerns, we've also started offering virtual visits to our patients to keep up with their needs, and they're also seeking medications to manage depression and anxiety.
Thank you. Dr. Parry, hospitals continue to care still for populations in their inpatient wards who are fighting COVID, but certainly the outcomes have greatly improved since the first wave. Can you give us some insight on what our great physicians in Fairfield County are doing to improve the outcomes for people who are infected with COVID?
Yeah, I'd like to just piggyback on Dr. Khan's comments about seeking care, because the hospital and your physician office or your clinic is probably the safest place to go. People shouldn't be afraid of going to the doctor or to the clinic because most of those folks are vaccinated by now. So in reality, you're much safer going to the doctor's office than you are to the grocery store because of the fact that your providers, most of them, have been immunized already. And therefore, your risk is even lower than it was when we said this is a safe place for you even before vaccination. So I think the community and individuals should be really reassured that because of the vaccination program, their physician's office is a very safe place for them to be. Plus, we're still continuing the masking and hand washing and distancing. So I did want to add that point because I think it's an important point in reassuring the public.
Mm-hmm.
The inpatient status of COVID now is vastly different in the Northeast than it was in April and May. At Stamford Hospital, we had 150 inpatients with COVID that was half our census was COVID cases. The mortality in ventilated patients was 80%. Of the overall mortality was 20 to 30% if you ended up in the hospital. Frankly, the mortality if you end up on a ventilator is still 80%. So although we think that things have improved, and they have in a global sense, if you're sick enough to get admitted to the ICU and require a ventilator, then your mortality is exceedingly high, and we have yet to really make inroads at that level. That being said, I think that the overall hospital census is lower because we have been using monoclonal antibodies. We've been using steroids more liberally. We understand a little bit more about the disease. We're using high flow, not intubating. So some of the management has improved outcomes, but still, if you're sick enough to get bad COVID and need ICU care and ventilator care, this is still a fatal disease most often. So some progress has been made. I think the biggest progress is our vaccination program, which has the hope of turning this pandemic around.
Certainly, it says a lot for our local hospitals and how they've improved in the quality of care and handling COVID, certainly from the first wave to where we are now. People are also concerned about the variants and what they are reading about how the severity has increased with the new variants that are coming out. Dr. Khan, can you help them understand a little bit about the severeness by variants, and is it something that we should be worried about and concerned about?
So just to give a rough idea of how many cases have been reported of the variants in all of the United States, so far we've only had 1,661 cases of the UK variant, and 44 states, including Connecticut, have reported towards the UK variant, and only 22 cases nationwide have been reported of the South African strain. There's still a lot that we're learning about these strains, and CDC is actively monitoring the variants and trying to study the characteristics. The studies that have come out of the UK have shown that it is easily transmissible. It can spread quickly. And there was data that showed that there might be an increased risk of death. However, more studies are needed to confirm that finding. We don't know enough about the mortality data related to these strains. However, we do know that it does spread pretty quickly, and if it can spread quickly, then it can lead to more hospitalizations and more cases. On another note, studies do suggest that antibodies generated through vaccination do recognize these variants. And that's why it's so important to continue to follow the public health mitigation strategies, whether it's maintaining social distancing, getting vaccinated when people are eligible, keeping up, continuing to use masks, focusing on hand hygiene, and isolating and quarantining when people are exposed to limit the spread of the virus as much as possible.
You read and you see, and certainly we've all experienced patients who have remained asymptomatic through their entire COVID disease and their recovery, while others it has been fatal. Dr. Parry, can you help our listeners and bring it down to even my level to understand the different body responses that are occurring to being exposed to a virus?
Yeah, I wish we knew more, and we don't. We do know what's a risk factor. The most important one is age. That's obviously why the approach to vaccination was to stratify the population by age, so that over 75 years of age, the nursing home population, long-term care facility folks, I mean, those were the most severely affected by COVID-19, the highest death rates, the greatest morbidity. And since they have been shown to respond nicely to these mRNA vaccines, they obviously it made the most sense to vaccinate them first, because the greatest risk benefit or benefit risk is in that population. There are other conditions which put you at greater risk: obesity, heart disease, kidney disease, other conditions where you might be immunosuppressed. All of those increase the risk. But age is the overwhelming risk factor. And so the state of Connecticut has decided to stratify almost totally by age. So we've gone to 75 and over, to 65, to 75, and effective March 1st, 55 to 64. Just looking at the age stratification. And if you look at the graphs of mortality by age, it's very clear that, over 55, the risks dramatically increase, and over 75, it's obviously the greatest. Below age 55, the mortality rates are very low, and probably at that point, the other coexisting conditions take on more importance as a risk factor below age 55. They're obviously more complicated and more difficult to categorize patients as they come into the clinic for vaccination. Do they bring a doctor's note? Do they self-proclaim that they have diabetes? How do you adjudicate that? It's very difficult. Obviously, age is a very simple thing and a very easy thing for a mass vaccination clinic to handle. We do know that the initial phase of the illness is the virus that causes, respiratory infection. But that second part of the disease that makes people really sick is this immune response, which is why steroids work. which is perhaps why other immune modulators like IL-6 inhibitors work, if they work. So there's a double phase to the disease, but we don't really understand what it is about an individual that makes them more susceptible to that immune phase. We don't have a test that we can do to see who is more susceptible and who's less susceptible. The risk stratification is really very broad by age and coexisting disease.
Well, people have theorized, and I keep reading these articles about ACE inhibitors and the enzyme ACE2. Has there been any research that you've seen on any type of medication that may have prevented someone from developing a more severe reaction, if you will, to the virus?
I think that certainly there are other biochemical risk factors. If you're blood type A positive, that's a risk factor for a bad outcome. If you're male, if you have higher ACE levels because perhaps the virus can bind better to your cells, that might be a risk factor. One of the theories that children do better is because they have lower ACE levels, and perhaps that's part of it. A lot of this stuff is not well understood, and there's nothing that you as a patient or me as your physician can do a quick test to see and say you're at high risk, except maybe your blood type, and you're at low risk. So those tests are really not well worked out at this point.
Dr. Khan, a lot of people worry that have recovered from COVID that there may be secondary health issues and complications that may develop later on, from heart conditions to pulmonary conditions. Are they right to be concerned, and has there been any research at all from some of the delayed or secondary complications that may exist?
So there's a lot that we're learning about this disease, and since the first wave, we've learned a lot as well. Recently, there have been case reports in the literature of patients continuing to report persistent symptoms even after recovering from an acute infection. And these symptoms can be seen in young survivors who've had only a mild or moderate form of the disease, as well as in those who've had severe form of the disease. Some of the most commonly reported symptoms have been continued fatigue, shortness of breath, having joint aches or muscle aches. Some have even reported cognitive impairment, and then development of depression, as well as headache. More serious complications have been reported as well, affecting the heart as well as the lung function abnormalities and continued loss of sense of smell and taste. There's a lot that we don't understand about the pathophysiology of what leads to development of these persistent symptoms compared to others who don't. But to understand it better, there have been post-COVID-19 care centers that are opening up. I know here at Nuvance Health, they're looking in the next couple of weeks, they will be launching a post-acute COVID-19 care center, which will take a multidisciplinary approach in helping patients recover from these continued symptoms.
Thank you. Thank you both very, very much for all that you do for your communities and keeping us safe and for our patients. This program has been extremely informative, I think, to our community with the most up-to-date research and as well findings that we have. And again, Dr. Khan, Dr. Parry, thank you for our listeners, on behalf of our listeners in Channel 79. Thank you.
Thank you.
Thank you.
I would like to again thank our physician panelists and for the work that they are doing each and every day on the front lines to keep us safe, and to Channel 79 for hosting this program. Accurate and timely information is critical, and we all as a community, a network of healthcare providers, want the very best care for our residents and to continue expanding our testing and vaccination programs. Seek out your physician's recommendation and please continue to reach out and to access these vital services. We still may not know what secondary medical complications may arise from catching COVID. And I know that I speak for all of our panelists and that we hope that you desire to take every precaution to protect yourself and to prevent the continued spread of this disease. It hits our citizenry indiscriminately, and while you may test positive and be blessed to remain asymptomatic, know that you're in the minority, and many more have not been as fortunate. Let's reaffirm our commitment to each other. Please continue to support our efforts and the network of healthcare providers and first responders as they continue their fight and continued protection for our citizens. It continues to be a long and heartfelt fight as we transition into our second year, and recognize that it has been exhausting for those on the front line. Each of us has a role to play, and you can help in your own way. Thank you for tuning in, and thank you for what you have done and what we know that you will do to help in our continued efforts. Thank you and good evening.